want to talk about is, as you all know, the House's main priority has been on this issue called the 2020 thought process, that we're trying to move towards thinking into the future. So beyond the fact of having the Ohio 2020 Tax Policy Study Committee, which will again help the governor aid in his efforts to try to formulate and focus on where we should go in the future for our state on our tax policy and give more input and insight. We're also doing, as I said, the Education Study Committee, the Joint Education Oversight Committee, a Grace Commission that will review each line item to see where mergers can continue to happen to save monies, and JMOC is going to be directed in both the Grace Commission and JMOC's request to look at Medicaid line items to see where there's redundancies, to where there's programs that we're also paying for that Medicaid currently covers, to take a look at those and make recommendations by the end of the year for those things to be pulled out. So those are some areas that we also have been looking at, and definitely looking into the future as we continue this budget process along with other things. I want to quickly, before we do questions, again see if Chairman Sprague has anything to add on the Health and Human Services item, and ask Representative Amstuz to quickly talk about Healthier Buckeye.
Thank you, Mr. Speaker. I guess the first thing I would add is just that I think that with regards to the Medicaid expansion, there's a realization that in order to make this program sustainable over the long term for the state of Ohio, we have to have some dramatic reforms to the system. And some of those reforms have already been talked about, the price transparency piece. We have to know what hospitals and other providers are actually charging you when you walk in the door to get a procedure. That helps everybody, not just our Medicaid system, but every consumer in the state of Ohio. It's about time that we know what those prices are as a state and as citizens of our state. The second piece is the health savings account, which obviously makes people on Medicaid, in addition to everybody here in the room who probably has a commercial plan or a health savings account. So now everybody has skin in the game. So now you have a reason to pay attention to the prices and hopefully choose that lowest cost option. The third piece is, with the Medicaid expansion, we now have able-bodied adults without children that in some cases are beginning to crowd out what we would call our traditional responsibilities in the Medicaid system. Individuals that have developmental disabilities and others, children. And we need to make sure that if you're an able-bodied adult, that although there's a time that you might spend on the Medicaid system or on our food stamp assistant program, that you go back to work, that you get back into the workforce. I think as Ohioans, the one thing that we've been always known for in the United States is our ability to work. And so we are looking at pursuing a work requirement for the SNAP and the food stamp programs as we go forward as part of our longer look at the Job and Family Services case management fees.
Ron, we're going to cover Healthier Buckeye.
Well, building on what Chairman Sprague just said, the idea of helping our communities at the community level to wrap around those who are looking to improve their situation to the point where they don't need Medicaid or they don't need other forms of public assistance is a very big project. But we see the administration's budget proposal having a real focus on intensively working, mentoring with, and case managing individuals who are in that mode. And we like that to the point where we want to build on some things that we've passed in previous legislation by amplifying and more specifically requiring activity at the local level that's focused on the whole needs of individuals. And those are going to have to be customized in order to make them work for individuals and their families. And maybe there'll be some questions on that, but we have put in our bill that we're bringing out today some amplification that is this Healthier Buckeye program deployed at the local level, but also deployed with some resources that have not been available up till now either, that we are seeding a major fund that will be available to those who already demonstrated in many cases effectiveness but need amplification to reach more people, and also to help our local county level or multi-county Healthier Buckeye councils that are going to be formed as this year goes forward to get engaged and to be successful. So that's a little bit about what we're trying to do. The administration has proposed a series of case management steps that need more work because they haven't yet had, I don't think, enough collaboration with the folks that are going to be down on the ground making this happen. So we're going to create a process in a separate bill that the Speaker alluded to that I'll be helping to carry, in addition to the language that we have in the budget, so that we will try to work that towards a conference committee further mature set of plans. And we look forward to working with the administration, the Senate, and outside parties who have a direct stake in trying to help our state become a stronger place for more of our citizens.